In order to talk about the types of knee replacement, we need to talk about the anatomy of the knee. The knee is divided into 3 compartments: the inside, the outside, and in the front. When a patient has arthritis in just one of those 3 compartments, then we can do a partial knee replacement. The advantage of a partial knee replacement is a quicker recovery and a less artificial feel of the knee. Not all patients are a candidate for a partial knee replacement based on their pattern of arthritis. A total knee replacement replaces all 3 compartments of the knee. By doing this, all the arthritis is removed from the knee, which makes it a more definitive surgery for the treatment of knee arthritis, and it also has an excellent long-term track record. At Henry Ford Health System, we will choose the best approach to your knee arthritis to get you back to the things that you enjoy.